Syrian regime isn't just using mortars and rockets. According to one aid organization, it's also using medicine as a weapon. Security forces are patrolling hospitals, searching for wounded protesters, and preventing crucial supplies from making it into the hands of doctors. Some doctors have been forced to set up underground clinics where every day they try to treat the wounded in secret and put their own lives at risk. This doctor has just received 5 wounded children from the same neighborhood. Doctors Without Borders isn't allowed in Syria, but it's collecting testimonials from people who have left, and their stories are terrifying.
ما في سيارة إسعاف، سيارة الإسعاف عم بقنصوها بقتلوا اللي داخلتها، أما مش عرفت شلون؟ عادي يغمضوا لي يعني فضلي مرة كذا شباب، لأنه ما حد يصير يظل بالمشهد. بقول لك إذا اليوم نفت بكرة يمكن يجوا يأخذوني.
Dr. Abdul Ghani Sankri Tabrishi is the director at large for the Syrian American Medical Society, and throughout this crisis, he's been in touch with his colleagues in that country. He joins me tonight from Detroit. Doctor, thanks for coming in to talk to us, and tell us what you're hearing out there. I want to hear the stories of how doctors are now becoming a target in this uprising.
Thank you, Mark. The situation for the physician is so appalling. These physicians or healthcare workers, since the uprising started in Syria, have been risking their lives, their careers, to help actually the wounded and the injured. They have very limited resources. In Syria, more than 50% of the hospitals are controlled by government, and people are resisting to go to those hospitals because they get arrested. Therefore, they prefer to stay home and not to go to seek help. The physicians in Syria try to build a network of clinics underground to help these injured, and despite that, security forces are following them and targeting them. 2 days ago, there was a field hospital in Homs that was attacked and 3 doctors were killed. The situation is so difficult for physicians to practice their duties. They're risking their lives, and they are in very bad situation. The worst feeling for a physician that to see a injured person in front of you dying and you can't help him.
What happens? I mean, with the activists, if the activists do end up in a hospital, what is their fate if anyone from the government or any soldiers or security forces are around? What do they do to them?
The situation, actually, they're targeting them even if they go to the hospital. This is how they track those protesters, by finding them in the hospital, especially if they're injured. There's a very emotional story was reported by an anesthesiologist in Homs a few months ago, that she was in the operating room operating on 2 patients. One of them had open abdomen, and the security forces attacked that hospital, forced actually under the gunpoint the receptionist to lead them to the operating room, and they forced the physician to open that door, and then they entered the OR, and they requested to disconnect the ventilator. These are general anesthesia, to disconnect the ventilator so they can take those two men who were protesters. The physician was begging them to just finish the operation, or at least close the abdomen. That patient has open abdomen and his intestines were exposed. They refused, they declined, they disconnected the patients, and they took them away and put them in a military vehicle and drove away. And we were sure actually they're dead, because after a few minutes without oxygen, they will die.
Doctor, what can you do to help?
We are actually appealing to the community, international community. We have heard from a lot of stories from inside Homs even today. There's hundreds of wounded, that they're asking us, international community, to put pressure to first stop the killing in Syria. Second, actually to allow humanitarian corridor for civilians to escape these fightings, and to allow the wounded to be transferred safely and be treated. We are demanding in the Syrian American Medical Society and other friend organizations such as Doctors Without Borders and Red Cross to allow, actually through international coverage, to allow us to go there under protection, international protection for physicians, and the Medical Neutrality Act to help these people to be transferred and treated in neighboring countries.
Humanity, I guess, is what you're, in short, asking for. We'll follow and see how that request request is met. Doctor, we appreciate your time tonight. Thanks for coming in for us.
Thank you, Mark.